Never once was I given such a high bill with no warning.
An Eyewitness News exclusive right now. She was blindsided by a $9,000 bill from a hospital she never visited. Tonight, the I-Team investigates surprise medical bills. It's happening so frequently, Congress is now getting involved. I-Team reporter Matthew Campbell looks at the struggle of an East Hartford woman who is battling health issues and big bills.
MS runs in Ashley Stern's family. After experiencing leg weakness, muscle spasms, and sight problems earlier this year, her doctor suggested she get a series of MRIs. He booked the appointments for her here at Evergreen Imaging in South Windsor. She initially wanted to go to a less expensive place, but followed her doctor's orders.
When I asked what the cost difference was, it was a matter of a few $100s.
Her insurance company, managed by Cigna, told her the grand total for all three would be roughly $1,500.
I had no idea how to figure out what that 20% was, but I knew that was going to be my copay.
She got 3 MRIs done at Evergreen and the bill came. She saw the $1,500 for the MRIs and she paid her 20%.
It ended up being about $172.
But when going through her explanation of benefits page, Ashley was blindsided by this, an $8,900 charge from Rockville Hospital.
I've never been to that hospital. Why would I have a charge?
She called the hospital and learned it's because Evergreen is under the umbrella of Eastern Connecticut Health Network, better known as ECHN.
I said to her, $8,900 because I used the room for a couple of hours, and she said yes.
But Ashley says no one at any point from her doctor to Evergreen to ECHN warned her prior to getting the MRIs.
I had no way of knowing. They couldn't tell me at the prior auth department, and even if you were to call Evergreen Imaging, they bill separately.
When the actual bill arrived, it came with this printed note informing her after the fact that if she had not gone to Evergreen, her expenses would have been less. That's when she called the I-Team.
I wanted to do this interview because I wanted people to know, because I was honestly shocked. I was shocked that this is the way it works.
And the question remains, why does the fee dramatically eclipse the amount of the actual procedure? The I-Team reached out to ECHN asking them to explain how fees are calculated and how they're being relayed to patients. They responded, quote, "Many patients do not understand the benefits and limitations of their insurance coverage until the moment they need to use it. Patients who have chosen a high-deductible health insurance plan may not be fiscally prepared for the out-of-pocket costs associated with their coverage."
They know exactly how much that's going to cost, and they have an opportunity to speak with your insurance company prior to the service when they got the authorization to find out exactly what your portion of it's going to be. To put a disclaimer on a statement is just very stunning that it would be stated after the fact. What is the purpose of stating it after the fact?
These surprise bills are popping up in mailboxes across the nation. According to a Kaiser Family Foundation survey, 4 in 10 insured Americans say they received a medical bill in the past 2 years they thought was covered. Congress is crafting legislation that would limit what patients get charged for out-of-network care and make providers and insurance companies deal directly with each other rather than putting the patient in the middle.
A lot of folks go into bankruptcy over this. And it's, we should have a better system for it.
After numerous calls between ECHN and her insurance company, Ashley is now in a payment plan and is stuck with $3,000 of the facility fee, which still doubles the cost of the MRIs.
When you go to the vet with your dog, before they perform anything, they give you an estimated cost. When you go to the mechanic to have your car fixed, you don't spend $10,000 on your car without them letting you know how much it costs.
Since the MRIs, Ashley has had a spinal tap, blood tests, and another MRI done, and all of those procedures have been done elsewhere. And she now asks the critical question, is there a facility fee or is the outpatient facility associated with a hospital? I just did a separate video that's posted to the Channel 3 app of the 3 things you can do to protect yourself from a surprise bill. For the I-Team, Matthew Campbell, Channel 3 News.